Hollow eyes. What options do I have? Going in for my routine Juvederm injections and was curious about what options I have for under-eye treatment. I believe Restylane is most popular. I just have a bit of hollowness. Thanks.
Thank you for your question. You stated in your question, which you submitted without a photo, that you're going in for your routine Juvederm injections and you're interested in options for under-eye hollow treatment, and you understand that Restylane is popular, and you say that you have very slight hollows. So certainly I can give you some idea about how I approach people who have this type of concern when they come to my practice. To give you a little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon, specialize in cosmetics and reconstructive procedures of the eye area. So understanding that with many different options when it comes to the perception of under-eye hollowing, we have to define what is the cause of the under-eye hollow concern. For example, it is very common for people to feel that they have a hollow when they happen to also have puffiness. There's a difference between puffiness and hollowing that you need to make sure you understand going in, so you don't make an informed decision. When we talk about under-eye hollowing just alone, and this is the absence of puffiness, then we're dealing with basically loss of volume in the area of the tear trough and the eyelid cheek junction. In this area, it's routine for me to place Restylane. Restylane is a softer filler, a hyaluronic acid filler. I often combine it with platelet-rich plasma to help the skin quality, because very often people who are concerned about under-eye hollowing are also concerned about the dark quality of the skin, the thin quality of the skin, and often there's sun damage and other issues. So the filler can be placed very strategically and used to improve the under-eye hollowing. Now, what happens if you have puffiness? Well, if it's a minimal amount of puffiness, you can still get away with placing a bit of filler. What's interesting is a lot of times people really over-interpret what they consider is a minimal amount of puffiness. We have patients who have very large bags under the eyes come to the office and say, can you put filler to deal with the hollows? And when I show them what the puffiness is, which is, for your information, is lower eyelid fat prolapse, which means that the fat around the eyes pushes forward and creates a bulge, and that bulge acts like a mountain, which makes the adjacent area look hollow. So they learn that if the puffiness is too big, then the under-eye hollow can't be improved with filler. And I tell you that as a specialist in oculofacial cosmetic surgery, patients come to me from all over the world with filler issues related to trying to hide under-eye puffiness as well as to address under-eye hollows. What we end up doing is using enzymes like hyaluronidase to melt away this material to get rid of this excess volume. So you have to be careful about making the decision about filler. Less should be just enough. If you're putting a lot more filler, then you have to ask yourself, what are you really addressing? Are you dealing with a deep under-eye hollow? Or are you dealing with cheek volume loss? Are you dealing with really lower eyelid fat prolapse or puffy under-eye bags? So in addition to the hollow issue as well as skin quality from a thickness issue, we also deal with helping people with discolorations under the eyes. And sometimes a little bit of laser, whether it's a fractional laser or an ablative laser, or even a light peel, or even something minimal like the use of topical retinols, can help the under-eye hollow appearance. So speak to your doctor, who you're going to for your routine Juvederm, and ask about these options. Learn about what makes sense for you. Try to make sure you're able to distinguish what is hollow and what is puffy, and then move forward. I think that Restylane is a very good option for this type of situation, because we have a lot of experience with that. We use blunt cannulas and we place the material in a way to minimize the trauma and improve the area. And it can be interesting. The material can actually last a lot longer than it does in the dermis, but that's a separate discussion. So I hope that was helpful. I wish you the best of luck, and thank you for your question.